Hello everyone, I hope and I believe you all are doing great. Let's start with the next topic, that is the topic of nephrosclerosis. Okay, now nephrosclerosis, it's not that important topic, but it's not that also topic that you can leave. You should read this topic. Let's start. Nephrosclerosis, what it is? Nephrosclerosis is basically a form of renal vascular disease. Okay, it is a form of renal vascular disease characterized by sclerosis. There will be sclerosis, there will be renal arterioles and small arteries that will be leading to the fibrosis and finally will be leading to the ischemic atrophy. And you know what is ischemia? Ischemia means when there is a loss of blood supply to that area. It is most commonly associated with hypertension and diabetes mellitus. Okay, you have the two types, that is, what are the two types you have? You have either the benign one or either the malignant one. So what happens in the benign one? In the benign one, it is long-standing benign hypertension, and in the malignant one, it is accelerated or malignant hypertension. Let's talk about the types and pathogenesis. So in the type 1 that you have is the benign nephrosclerosis. So benign nephrosclerosis is basically long-standing mild to moderate hypertension. It is of longer duration as compared to the other one. There will be aging and it is also related to your diabetes. And for diabetes, you have a criteria. What are the criteria we follow for diabetes? That is 126 and 200, 200 and 6.5. What is 126? Your fasting blood glucose level should not be more than or equal to 126 mg/dl, and your random blood glucose oral tolerance test should not be greater than or equal to your 200 mg/dl. And your HbA1c should not be greater than or equal to 6.5. See, tongue twister. I can try any tongue twister. Let's see about the pathogenesis. So there will be chronic hemodynamic stress. Firstly, there will be stress. After that, there will be hyaline arteriosclerosis. After the hyaline arteriosclerosis, there will be the leakage of the blood vessels wall and there will be increase in the matrix synthesis, which leads to the arteriolar narrowing. All the blood vessels will be getting narrowed. There will be chronic ischemia. Okay, if the blood vessels are getting narrowed, there will be a loss of blood supply also, right? And if there is loss of blood supply to that particular area, as a result of which there will be ischemia. There will be tubular atrophy and the intestinal fibrosis. Let's talk about the malignant nephrosclerosis. So malignant nephrosclerosis is basically seen in the patient who are having hypertension, like the BP that is more than or equal to 200 by 126 millimeters of mercury. What is the pathogenesis? There will be the severely elevated blood pressure will be there, as a result of which there will be endothelial injury to the arteries. Arteries will be getting the endothelial injury and there is increased permeability to fibrinogen, and there will be platelet deposition. Firstly, there will be the endothelial injury. After the endothelial injury, there will be all the platelets will come into the action. There will be platelet activation, as a result of which there will be fibrinoid necrosis of the arteriolar. There will be hyperplastic response. I have told you that you have to tell me in which structure and in which places we have read about the onion skin appearance. Okay, onion peel appearance or onion skin appearance. Let's see about the pathology. Grossly, what you are able to see, there will be benign nephrosclerosis. Kidney will be normal or slightly reduced in size. The surface will be finely granular. It will be like a grain leather. Okay, see, small dot will be there. Okay, due to the cortical scarring. And in the malignant nephrosclerosis, the kidney will be normal or reduced in size and sometimes petechial hemorrhage will be seen, just like we have seen in the cases of 𝗵𝗵 kidney. Like this was the kidney. This is a 𝗵𝗵 kidney. Okay. In the microscopy, what you are able to see? You are able to see there will be benign nephrosclerosis. There will be hyaline arteriosclerosis of the arteries. Okay. And there will be ischemic granulosclerosis, tubular atrophy will be there, and intestinal fibrosis will be there. The arteries will be having the fibrinoid necrosis. Onion skin hyperplasia will be there. What are the clinical features in the benign one? In the benign nephrosclerosis, we are able to see that it is usually asymptomatic. There will be mild proteinuria that will be there, and microscopic hematuria. See, I don't need to explain you these terms again and again because I have already explained you beautifully, okay? It is slowly progressive and renal insufficiency will be there. Hypertension is usually stable and controlled. Next, you have is the malignant nephrosclerosis. Okay, there is sudden onset malignant and accelerated hypertension. The blood pressure is more than or equal to 200 by 120 millimeters of mercury. The symptoms will be, there will be severe headache, visual disturbance, retinal hemorrhage, and exudates will be there. And there will be acute kidney injury. There will be acute kidney injury, and you have to keep that in mind, okay? What are the investigation? First thing, urine investigations. In urine, the benign one will be having mild proteinuria and hematuria. The malignant one will be having hematuria, RBC cards, and proteinuria. In the blood, what you are able to see? You are able to see that there is increased or elevated level of serum creatinine and urea. In the hemolysis, you will be able to see there will be the schistocytes and increased level of LDH. In the malignant cases, if the case is malignant, then you are able to appreciate these lab values. In the fundoscopy, what you are able to appreciate? In the benign one, there will be arteriolar narrowing and silver and copper wiring. In the malignant one, there will be papilledema and flame-shaped hemorrhage. One thing that you need to keep in mind whenever you are writing about the malignant one, that is the cotton wool spot. In the imaging, we will do the USG and CT. Kidneys will be small or shrunken, okay, in the benign one, and normal to reduced in the malignant size, just like we have seen in the acute and the chronic tubulointestinal nephrosis. In the acute one, the kidney were normal, and in the chronic one, the kidneys were shrunken. In the renal biopsy, it is rarely needed and it is risky in cases of malignant hypertension. What are the treatment protocol that you have to follow? For the benign nephrosclerosis, you have to control the hypertension of the patient. You have to give them ACE inhibitors, ARBs, and calcium channel blockers and diuretics. You have to manage the comorbidities like diabetes, dyslipidemia, and you have to ask the patient for a lifestyle modification, because a healthy lifestyle can prevent many of the diseases that you are not even aware. So you have to live a healthy lifestyle. Instead of living a sedentary lifestyle, just try to live a healthy lifestyle, okay? You have the malignant nephrosclerosis. It is medical emergency and it requires immediate blood pressure control. IV antihypertensives you will give, dialysis if acute renal failure develops. Then you have to treat the underlying common causes of hypertension that are there. Any other complication if the hypertension is causing, like they are causing any kind of organ damage, then you have to treat the organ damage as well, okay? Let's see what are the complications can occur. So the complications that can occur, first one, in the benign one. In the benign one, the complications that can occur are your end-stage renal disease and your CKD. That is, chronic kidney disease can progress to end-stage renal disease in some patients. In the malignant one, you have your acute kidney disease, you have the retinal damage and hypertensive encephalopathy. Okay, let's just revise what we have read over here. So the only thing that you need to remember, that it is a form of renal vascular disease. You have two types, benign and malignant. Then we have seen about the pathogenesis of them individually. The main underlying cause is hypertension. You have to treat the hypertension. Grossly, you will be able to see some like structure, and the malignant one, you will be having a flea-bitten kidney. Right, the clinical features we have seen of them separately, investigations also, and the complication that it can lead to. Chronic kidney disease can lead to an end-stage renal disease. So we are done with this topic as well. If you are having any sort of doubt, please feel free to ask me. Please feel free to DM me. Thank you so much.